Hello everyone, my name is Santhi Vege. I am the director of the multidisciplinary pancreatic clinic at the Mayo Clinic. I'm going to tell you a few words about neuroendocrine tumors of the pancreas. And neuroendocrine tumors of the pancreas are quite common. This has to be distinguished from cancer of the pancreas, which you all know, which there is a taboo about pancreatic cancer because of its seriousness. Neuroendocrine tumors also can be benign or malignant like pancreatic cancer. But the interesting thing about this disease is that they are not as fatal as pancreatic cancer, and with the sophisticated treatment modalities that you can have at a good institution, you can lead a comfortable life for a long time, and a greater proportion of these patients can be actually cured as opposed to pancreatic cancer. Hence, you can see it's very important for a physician to make an accurate diagnosis of neuroendocrine tumor so that a permanent cure is possible for the patient. Then a small proportion of these patients have very interesting clinical presentations. These neuroendocrine tumors secrete a variety of hormones, and these hormones can produce various clinical syndromes, as we call. They can present with interesting rashes, or with peptic ulcerations, or with significant diarrhea, or gallstones and low blood sugars. These are all the weird manifestations of the excessive hormones that these tumors secrete. And it's most important in those cases, the treatment would not only get rid of the malignant tumor and give them life expectancy, but will also improve their quality of life by taking away these hormonal symptoms, which can be really debilitating. Now, to properly diagnose these tumors and then to give them a proper treatment, which is really many facets in the treatment. The treatment includes chemotherapy, surgical excision. Sometimes just endoscopically you can inject some material into these tumors and shrink them. If these patients are not operable candidates, then you can do interventional procedures by radiologists by injecting substances into the liver if the tumor has spread to the liver. Then you have biologic agents which actually act about the tumor proliferation, not chemotherapy, but biologic agents. They can be pills, they can be injections, and a combination of all these things. Sometimes we are super aggressive in these people, unlike pancreatic cancer, because by putting all the treatments we have, we can actually reduce the tumor bulk to the minimum and give a long life as well as a quality of life to these patients. Similarly, in the diagnosis, you have to have a variety of special blood tests to detect these hormone excessive states, then special scans called octreotide scan. For these reasons, when you have a big multidisciplinary group of everybody, diagnostic radiologists, interventional radiologists, medical oncologists who are exclusively specialized in neuroendocrine tumors, pancreatologists who are the quarterbacks, surgeons who have a special interest in this, interventional endoscopists who can do all the procedures, sometimes including destruction of the tumor by injecting some substances. All of them have to be available under one roof. There are very few centers in the world. You can count on fingers that you can have such expertise under one roof. Mayo Clinic is obviously one of the places because of the multidisciplinary pancreatic clinic. So this is one thing that I would request the physicians, the patients, and the families to keep in mind for diagnosis and therapy if you have a neuroendocrine tumor, either functioning because of excessive hormones or non-functioning as the case may be, to keep Mayo Clinic in your mind and the pancreatic clinic at the Mayo Clinic to get the best outcome. Thank you for listening.